This morning on today's update, the Berns triplets, three young sisters undergoing a new treatment to erase a lifetime of scars. We met them back in May, and we'll find out how they're doing in just a moment. But first, NBC's chief medical editor, Dr. Nancy Snyderman, has their story.
For the Berns triplets, Jordan, Trey, and Chandra, scars on their faces, arms, and chests have served as a painful reminder of the tragedy that took place 20 years ago, when a house fire took the life of their mother. The triplets, 17 months old and asleep in their crib, survived with third-degree burns to as much as 30% of their bodies. The sisters underwent years of surgery, physical therapy, and skin grafts to heal their wounds, but the scars remained.
We don't really like wearing short sleeves or shirts that show our burns. We feel more comfortable hiding them, I guess you could say, because that is, a flaw to us.
Trey, the youngest of the triplets, learned of a Florida dermatologist experimenting with laser treatment. In one case, a burn victim's scars faded with a laser procedure normally used for acne.
For there to be some kind of hope for burn victims, I just felt like I needed to call.
The sisters reached out to the doctor, who, with the laser manufacturer, agreed to perform the procedure on all three of them free of charge.
I'm about to go get the treatment. I'm excited.
As part of the treatment, the laser fires tiny dots of heat deep into the scar tissue, vaporizing the scar and allowing a healthy layer of skin collagen to eventually regrow the skin on their faces, arms, and chests. The procedure would ultimately take 8 hours.
Go away, scars.
3 months and one follow-up treatment later, the sisters revealed the results on Today.
My scars are a lot smoother and the texture is a lot better. So I can definitely tell the difference.
So you love the changes that you see in the mirror.
Yes.
And Chandra?
Definitely the same for me. My skin is a lot smoother, great texture.
Better texture, smoother skin, and high hopes for greater improvement.
Triplets have had 2 more procedures since we last saw them in May. Let's take one more look at them before this all started. And here they are, Jordan, Trey, and Chandra Berns. Dr. Jill Waibel performed the treatments. Dr. Nancy Snyderman, of course, our chief medical editor. Ladies, well, this is the longest couch we've ever had here. Good morning to all of you.
Good morning.
Thumbs up, thumbs down, in the middle. What do we think?
Definitely thumbs up.
Yeah? Okay, Chandra, what do you had the most severe burns.
Yeah.
So talk to me about the results.
Well, over the past few months since we were actually on the Today Show last, it's pretty much a gradual improvement. Our skin has gotten a lot smoother. The texture is a lot smoother.
I can remember from the last time I saw you, there was more elevation, it seemed, here on this particular arm, and that is much smoother now.
Yeah, it's definitely a lot smoother.
And I know that we talked about 3 things. We talked about aesthetics last time. We talked about mobility, too, because scar tissue can limit mobility. What's been the results there?
Definitely, scar tissue can limit mobility, and I think for a lot of people, the ultra pulse laser will help with their mobility. It did for me right here. It's helped a lot.
Yeah,
with
that joint in particular was a difficulty for you, in your elbow joint on your left arm. What about self-esteem? I mean, we talked before about, the summer months came, and a lot of the young ladies that you knew were wearing short sleeve or tank tops, and you didn't want to do that. So talk to me a little bit about that.
Well, I think any burn survivor is a little self-conscious about their burns, just like we were. And from this laser treatment and sharing our story, we really gained a lot more confidence than we had before.
So just by talking about it and coming on a show like this and saying, the heck with it, let's take the secret part of it out of it and talk about it, that helped in addition to the laser?
Definitely, yeah.
Dr. Waibel, are these results fairly typical, what we're seeing here?
Yes, these are typical. We've treated hundreds of burn patients, and we're seeing great results. And remember, we can not only burn scars, but acne scars, surgical scars, traumatic scars. And the laser was brought to market for wrinkles, so it does a great job. But for burn patients, great improvement, and we're still studying it and learning more.
Ladies, let's talk about after the procedure. First of all, you're very honest. You say, you know what? It hurts a little. But you're given some topical anesthesia, is that correct?
Yes.
And it does hurt during it. Immediately following the treatment, what's the skin look like?
Right after the treatment, maybe for a couple hours, it's a little sore. It looks like you got a bad sunburn. And then over the next couple days, it'll, heal. And then after about a week or 2, you'll start peeling. And then
so the dead skin peels away.
Yes.
And that's when the new growth of the healthy collagen can take place?
Yeah, it takes months. It can even take up to a year. But we're removing scar, and then healthy skin is coming in.
Dr. Snyderman, what do you think about this? I mean, is this the wave of the future?
Well, I think increasingly lasers are going to change how we treat all kinds of things. So while it went from wrinkles and acne, and now we're literally talking about real medicinal reasons for, at least the skin. These lasers are out there, 70,000 worldwide, Jill told me. So this is another application. The real cool thing is going to be, how do you stimulate that deep layer of the skin where the stem cells are, where the collagen is, and sort of get the old scar off? And that's where the real science is going to be, whether you interject stem cells or whether you stimulate the patient's own. But, I mean, look at the proof. These guys are living proof of the fact that this works.
What about expectations here? I mean, the fact is you're never going to have skin that bears no scar, correct? So how many more treatments do you want to go? What level of change are you looking for?
Well, I think that's really up to Dr. Waibel, but we're thinking probably at least a couple more treatments. Every person is different, every scar is different, so, the number of treatments ranges from every person.
And there is a nuance in that, Matt. I mean, as a physician, you have to say good is not necessarily perfect.
Right.
So this is really good. Are you guys comfortable? And then that's that doctor-patient conversation.
And I think with the luminous ultra pulse, typically it's about 4 to 6 laser treatments. But I agree, when I'm happy or when they're happy or both, but every time you treat, you get improvement. And with the technology improvements that we see, with ultra pulse and other lasers, we're doing a lot better.
Real quickly, cost of something like this in an average case?
$500 to a couple thousand, depending on body surface area, but fraction of what surgery costs.
And better results than surgery.
Yeah.
Better results. We need both probably, but I agree. Yeah.
You look great.
Thank you.
And it's nice to have you back.
Thank you.
We appreciate your time. Doctor, thank you. Doctors.
Thank you.
Thank you very much. By the way, you can watch the Berns sisters' video diaries. They're on our website at todayshow.com.